Hello everyone. Today we'll discuss about one of the common metabolic disease occurring in today's date, that is the diabetes mellitus. Now first of all, what is diabetes mellitus? Diabetes mellitus is also commonly known as diabetes, and it is actually a group of metabolic disorders which is characterized by high blood sugar level in the body over a prolonged period of time. And the common symptoms seen in the diabetes mellitus patient are the polyuria, or we can say frequent urination, polydipsia or increased thirst, and polyphagia, that means the increased hunger. So polyuria, polydipsia and polyphagia, these are the very common three symptoms seen in the diabetes mellitus patient. The other symptoms include the delayed wound healing, the increment or the decrement in the weight of the patient, tingling sensation occurring in the hand or feet, dizziness, irritability and blurred vision are other symptoms of the diabetes mellitus patient. Now what is the normal range of blood sugar in the body? So over here, as you can see, these three tests are basically done to check the level of sugar in the body. So first of all, we have the fasting blood sugar level, and this fasting FBS, this fasting blood sugar level, this test is basically done after the overnight fasting, or we can say after the 10 to 12 hour of fasting. This FBS is basically done, and the normal level of FBS is between 100 to 125 milligram per DL. Now next is the PPBS, or the postprandial blood sugar level, and this test is basically done after 2 hours of meal. The normal range of PPBS should be between 120 to 140 milligram per DL. Now next is the random blood sugar level, or the RBS. Now this test is basically done at any time of the day. Okay, you can do this test even before meal or after meal. Okay, and this RBS, if this test is done after 1 or 2 hours of the meal, the blood sugar level in your body is less than 180 milligram per DL. And if you are doing before the meal, then the blood sugar level in your body should be ranging between 80 to 130 milligram per DL. And if the blood sugar level in your body is more out of any of these normal ranges, that means you are suffering from the diabetes. Now what types of diabetes mellitus occurs in the human? So first of all, we have the insulin dependent diabetes mellitus, or the type 1 diabetes mellitus. Now next is the type 2 diabetes mellitus, or the non-insulin dependent diabetes mellitus, also known as the insulin independent diabetes mellitus. Okay, the same thing. Now it can be diabetic prone state, or it can be secondary to the other causes. So we'll talk about these all individually. First of all, we have the insulin dependent diabetes mellitus, or we can say type 1 diabetes mellitus. Now over here, as the name says, insulin dependent. So over here there is of course some sort of problem with the insulin secretion in the body. Now what happens in the normal healthy human being is that the pancreas basically causes the secretion of the insulin. Okay, in the pancreas we have a group of cells known as the islets of Langerhans. Okay, and the cells present in the islets of Langerhans causes the secretion of the glucagon and the insulin by the pancreas. Okay, and out of the cells present in the islets of the Langerhans in the pancreas, the beta cells present in them causes the secretion of the insulin by them. Okay, and so this causes the insulin secretion by the pancreas, and this insulin basically causes the conversion of the glucose to the glycogen, okay, to be get stored in the body. Okay, otherwise the glucose will roam around randomly in the blood and will cause the increase in the blood sugar level in the body. Okay, but this insulin causes the conversion of glucose into glycogen, and then this glycogen is stored in the body, especially in the liver. Now what happens in the type 1 diabetes mellitic patient? Over here there is autoimmune destruction of the beta cells of pancreas. So we can say type 1 diabetes mellitus is immune mediated, or we can say autoimmune mediated. Okay, over here what happens is the CD8 on the T cells basically kills the islets of the Langerhans of the pancreas. Okay, and because of this autoimmune destructions of the beta cells of pancreas, this causes the failure of the insulin secretion by the pancreas, and this will cause the increment in the blood glucose level, leading to type 1 diabetes mellitus. So remember, type 1 diabetes mellitus is basically immune mediated, and this immune mediation is basically idiopathic, means the reason over here is not known. So it is idiopathic, it is immune mediated, and because of this the pancreas is not able to secrete insulin because of the pancreas destruction, or we can say the beta cells of pancreas destruction, causing the type 1 diabetes mellitus. Now next is the type 2 diabetes mellitus or insulin independent diabetes mellitus. Now as the name says, insulin independent, so over here in the body there is no problem with the secretion of the insulin. The insulin is normally secreted. Okay, but what is happening over here then? Normally in the healthy human being, the insulin which is secreted by the beta cells of pancreas gets attached to the insulin receptors present on the cell membrane. This is the cell membrane and this is basically the inside of the cell, okay, especially of the muscle cell, as you can see. So on the cell membrane we are actually having the insulin receptors, okay, and whatever in the normal healthy human being, what happens is this insulin basically gets attached to the insulin receptors present on the cell membrane. Okay, and this attachment of the insulin with the insulin receptors causes the activation of the GLUT4 by the way of protein kinase B. This protein kinase B, which is actually activated, or we can say facilitated by the attachment of the insulin with the insulin receptors, causes the signal transduction. Okay, and this basically signals to the GLUT4. This GLUT4 is the glucose transporter 4. And because of the activation of the glucose transporter 4, which is also present on the cell membrane, this causes the opening of the GLUT4, and this GLUT4 opens, and because of the opening of this glucose transporter 4, which is actually insulin mediated, the glucose will enter inside the cell. Okay, and then this glucose is utilized, or we can say it is also stored in the form of glycogen. Okay, so simply over here in the normal healthy human being, this insulin gets attached to the insulin receptors, and because of this causes the activation over here, and the protein kinase B becomes activated and facilitated, and because of this the signal is actually transducted and transferred to the GLUT4, causing the activation of the GLUT4, and this glucose transporter 4 opens, causing the entering of the glucose inside the cell, and over here by this the muscle basically uses this glucose. But in the type 2 diabetes mellitus, what happens? Over here patient's body becomes insulin resistant. Okay, and so receptors over here are not able to get sensitized by this insulin. Okay, because now these receptors are resistant to this insulin. Okay, and so because of this resistance, these insulin receptors are not sensitized by this insulin, and because of this resistance over here, what will happen? There won't be any kind of activation of the protein kinase B, and as because of this, what will happen? This signal transduction doesn't occur, and because of this the GLUT4 doesn't becomes activated and remains closed, and so the glucose can't enter inside the muscle. Okay, and this glucose will actually stay in the blood itself, and which will cause increment in the blood sugar level, and so type 2 diabetes mellitus occurs. So over here what we understood, normally there is insulin present and secreted by the pancreas, right? But over here the body becomes resistant to the insulin, and so these insulin receptors are now not able to get sensitized by the insulin, and so they are not able to bind with the insulin, and so the signal doesn't transfers, and so the GLUT4 doesn't becomes activated, and the glucose still remains in the blood, leading to the increment in the blood sugar level, leading to the type 2 diabetes mellitus. Now type 2 diabetes mellitus can occur in the obese person or even in the non-obese person, because over here the patient is basically having normal amount of glucose intake, but the body is not able to utilize their glucose, okay, for its purposes. Okay, and so the level of glucose in the body increases. Now very importantly, also listen that insulin independent diabetes mellitus, or we can say type 2 diabetes mellitus, also include the GCK modi. That means the glucokinase maturity onset diabetes of the young. So in the young person also, because of the defect, or we can say mutation of the glucokinase name enzyme, diabetes mellitus can occur. Now what is the role of this glucokinase? Why it is very important? So over here remember, this glucokinase name enzyme is basically present in the pancreas also and in the liver also. Okay, this enzyme is present in the pancreas and in the liver both. Now what happens? Now in the pancreas, this glucokinase name enzyme basically acts as a sensor. Okay, and whenever there is postprandial increment in the blood glucose level, this glucokinase enzyme acts as a sensor and will sense that increment in the blood glucose level in the body, or we can say the postprandial increment in the blood glucose level. What is postprandial? That means after the meal. Okay, there is increment in the blood sugar level in your body. Okay, and so this glucokinase will act as a sensor and will cause this pancreas to secrete more and more amount of insulin. And now this insulin will basically act on the liver, and because of this insulin, this glucokinase present in the liver will actually become activated and will cause the phosphorylation of the glucose. And because of the glucose phosphorylation, the glucose will be converted to the glucose 6-phosphate, and then this glucose 6-phosphate will go on to the glycogen synthesis pathway in the liver itself. And so by this, whatever amount of glycogen which was synthesized by the glucokinase in the liver will be stored inside the liver. So this is the normal pathway done by the glucokinase name enzyme for the synthesis of the glycogen to store the extra amount of glucose in the body. But in the GCK MODY, or we can say glucokinase maturity onset diabetes of the young, in that particular disease, this glucokinase enzyme is mutated. The mutation of this enzyme occurs, and so because of the mutation of this enzyme, whatever work was done by this enzyme will be inhibited, leading to the type 2 diabetes mellitus. Now let's have a quick recap of the type 1 and the type 2 diabetes mellitus. In the type 1 diabetes mellitus, if you remember, this type 1 is basically autoimmune mediated and it is idiopathic, and because of the autoimmune disease, there is destruction of the beta cells of pancreas, and this basically causes the failure of the secretion of the insulin by the pancreas, and so the blood glucose level increases. Okay, and in the type 2 diabetes mellitus, the body becomes insulin resistant. Okay, whatever the insulin receptors are present on the cell membrane becomes resistant to the insulin, and so because of this, the signal is not passed on by the protein kinase B, and so the GLUT4, the glucose transporter 4, is not able to open or become activated. And so whatever amount of glucose that is present in the blood remains in the blood itself and is not able to enter inside the muscle to be utilized by the muscle or to be converted into the glycogen, and so the blood glucose level increases in the type 2 diabetes mellitus because of the insulin resistance by the body, in simple words. Now next is the diabetic prone state. Now what do you mean by diabetic prone state? Now in this state, the person is actually not suffering from the diabetes mellitus, but in the body of the person there is very large amount of blood sugar level seen. Okay, and if this large amount of blood sugar level is not reduced by the patient, in the future the person will actually suffer from diabetes mellitus. So over here, remember, in this state the person is actually not suffering from diabetes mellitus, but the person is in such a state where if the blood sugar level is not reduced by the person will actually suffer from diabetes mellitus in the future. Now first case over here is of the gestational diabetes mellitus. Now what actually happens during the pregnancy is that the placenta releases such hormones which causes the body to become insulin resistant. Okay, and as because of this, temporarily the blood glucose becomes higher and higher. Okay, and if this blood sugar level is not reduced by the person may suffer from diabetes mellitus in the future. Now next case is about the impaired glucose tolerance and the impaired fasting glycemia. Now this is also known as the borderline diabetes. Now over here the person is actually having high level of glucose in the body, but this high level of glucose in the body is actually not extended the borderline of to become a diabetic mellitus patient. Okay, and so over here we can't say that the person is actually suffering from diabetes mellitus but has almost reached to the borderline of becoming a diabetes mellitus patient. Okay, so this is known as the impaired glucose tolerance. Over here the person is actually having high level of glucose but not yet crossed the borderline of it. But over here, if the person doesn't control the amount of glucose in the body, he may suffer from diabetes mellitus in the future. Now let's discuss about the diabetes mellitus secondary to other causes. Means over here the person is actually suffering from diabetes mellitus because of some of the other reasons. Now these reasons may be endocrinopathies, drug induced diabetes mellitus, or pancreatic disease may also lead to diabetes mellitus. So first of all, endocrinopathies. So first of all, we have the Cushing disease. In the Cushing disease, we all know what happens. There is over secretion. There is excess secretion of glucocorticoids by the body, which actually causes diabetes mellitus. Diabetes mellitus is also seen in the patient suffering from the thyroid disease. It can also occur in the patient suffering from the acromegaly, where there is increment in the secretion of the growth hormone by the body. Now, diabetes can also be caused because of the intake of some of the drugs, which includes the steroids and the beta blockers. Now, it can be also because of any kind of pancreatic disease. And the pancreatic disease includes the pancreatitis, cystic fibrosis, or hemochromatosis, which is because of the iron overload. Now we have one more term used over here in the diabetes mellitus, that is the metabolic syndrome. Now over here in the metabolic syndrome, there is impaired glucose tolerance seen in the patient. Also there is increased insulin resistance, increased lipid content in the body, increased nutrition in the body. Also of course there is increment in the fasting glucose in the body. There is decrement in the good cholesterol or the HDL in the body. And the triacylglycerol in the body of course increases, and it is more than 150 gram per dl. Now this metabolic syndrome is basically seen in the persons having very less physical activity or in the obesity, and over here the blood pressure becomes very high in the patient. Also the metabolic syndrome is related to the PCOS. So after understanding this whole explanatory video of the diabetes mellitus, what do we do now? If you are a diabetes mellitus patient or the diabetic prone patient, the very first thing that you have to do is cut down all the sugar supplements from your diet. Okay, just say no to sugar in your diet. The next step includes the exercise on daily basis. You can do running, you can do jumping, you can even do Zumba, but have exercise on daily basis. And also cut down all the fats and carbs and stick to a healthy balanced diet. So today up till here, I hope you understood it well. Thank you so much.